With the nation defining building of knowledge economy as one of its key goals, making ICT or information and communication technologies available to all has assumed more significance than before. To this end, eINDIA's 9th edition served as a platform for knowledge exchange between key stakeholders in the fields of governance, education and health sector. The two-day conference and expo saw panel discussions and presentations deliberating on means to make technology affordable and accessible to the common man.
India is to celebrate the digital success of our country. The IT in the government, in the areas of government to government, government to business, government to citizens, areas of ICT in education, areas of ICT in health, agriculture and various other areas. There is a big gap still which exists between industry and the government in adoption of ICTs. There are significant actions and steps like taken by the industry which the government can adopt easily, and if the government adopts those initiatives easily, the fruits of those adoption will be huge. So India has the aim to really bring together all stakeholders on a single platform and serve as a platform for sharing knowledge and ideas.
The event took place in Hyderabad and was inaugurated by the Honorable Chief Minister of Andhra Pradesh, Kiran Kumar Reddy, who gave his views on the ICT development in the government system.
For the government, it is important that every citizen in the state should services in the government which he requires should be easily accessible to them with least of corruption or least of trouble and no corruption. It should be hassle-free. That is what the citizen wants in our country today. In Me Seva, we have got about 153 services now. Many of you might not understand what is this Me Seva. Any certificate you want from the government, it could be your caste certificate, it could be your birth certificate, it could be your income certificate, lands showing your land properties, documents for your properties, encumbrance, all these certificates. You get them across the table once you go to the centers. We have got about now 7,000 centers. To start with, we started with about 10-15 services in one district. This is November, November 4th, 2011. Today we have got about 150 services with 1.5 lakh transactions a day. How does it help the citizen? He just has to go to this office. It is run by private people. It is not run by government. It is run by our agents who get a small commission for each transaction from the government. You apply to them and you get a digitally signed certificate for most of them. That is, we have got two varieties. Certain certificates require the inspection of an officer. Once the inspection on an officer is mandatory, the certificate, he has to go and inspect the site or inspect whatever has to be done and then give a certificate. So certain days are prescribed for such certificates, which are across the table. They are across the table. So on payment of that small amount, the certificate is given across the table to the person who wants it. How does this help? Usually officers or anyone, you cannot let the system, the government, depend on the honesty or on the efficiency of one individual or some individuals, and efficiency of the government cannot be judged by the performance of certain officers. Systems have to be in place, systems have to be perfect, you have to get transparency into the system. That is what is required for an hassle-free life of the citizen. That's what we are trying to do.
The point was further explored by a host of industry leaders and policy makers who discussed the key issues, challenges and innovations in the governance front.
On behalf of the Government of Andhra Pradesh, it gives me immense pleasure to welcome all of you to this two-day conclave of eINDIA. And it's also a matter of pride that we are hosting this event 2 times in a row. And if there was a prize to guess what is that single most thing which has remarkably changed our lives over the last 30 years, I'm sure all of you would agree that information technology would be a runaway winner. And this 2-day conclave, which will cover the sectors from governance to education to health and the use of information technology, I'm sure is going to further prove this point. I'd also like to take this opportunity to inform the gathering here that the vision and the seeds that the Honorable Chief Minister of Andhra Pradesh laid 2 years back. I'm saying 2 years because this was the date 2 years back when the Honorable Chief Minister laid the foundation for the Me Seva project. And between these 2 years, this seed has now become a complete full-blown tree. And Me Seva, from a very modest beginning of 100 centers, 10 services, 1 district, has now got 7,000 plus centers, 150 plus services, and all the districts. I'm very happy to inform you that we have covered more than 2 crore 35 lakh transactions in the last 1 year since Me Seva has stabilized.
The National ICT Policy 2012, which was approved by the Union Cabinet, had the ambition of taking IT sector to the next higher level. It has certain specific features and characteristics. First and foremost is that from a service orientation, we have to elevate ourselves to a product development orientation. Products, our products, Indian products, should really rule the world. We have that capability and we have that potential. The second is the electronics policy. That is, while we are strong on the software, we are making efforts in the last several months to build a base for the manufacture of electronics in this country. And obviously software becomes a very good complement to the hardware because we have tremendous design capabilities and we need to cash in on this. So we are giving a lot of focus on the electronics manufacturing in this country. Another component is the e-governance and mobile governance. Today mobile penetration is so very good that it is easy to reach the people through the mobile. So mobile governance is also receiving a lot of attention from Government of India and the state governments. For instance, the M-Seva portal, which has been launched by the Government of India last year, several state governments are participating. We are sending out 20 lakh messages to the citizens every day.
If we see the today's economy, especially the IT sector, that I am holding portfolio for about last 3 years, every young man or woman in the state, regardless of caste, religion, economic or social status, is able to obtain employment. The talent is the main criteria. This has wiped out the barriers between the rich and the poor, the socially challenged and the once upon a time so-called socially forward. There needs to be much progress to be seen. Today's corporate advantage.
We take a look at the highlights from eINDIA Education Summit. The 9th eINDIA Information and Communication Technology Summit saw the exchange of ideas between the key stakeholders in the fields of governance, education and health sector. Education Summit explored areas like emerging models for setting up new schools, education for all and fostering excellence in technical management education, among others.
So why do we need technology? You know, we talk about the tutoring for few, the school for few, then the school for the masses. And what the 21st century bring with the technology was what we call the personalized learning. And personalized learning means a lot of things, but it's very, very important that it bring better education, different kind of education, sometimes more context, less knowledge. At GEMS, we are carrying, I believe, 8 different curriculum. And CBSE curriculum is very close to the French curriculum, quite different from UK curriculum. That was surprised at the beginning when I've seen when an enter in this market, I may say. Very different from IB. And each time you need to think about the particularity of each of these curriculum to make sure that we adapt the technology, the content versus this different way of teaching and learning. But that we also bring new way to address, new way to engage with kids.
So what is driving preschools is increasing urbanization, nuclear families, women working, people can afford to send the children to preschools. The gross enrollment ratio is about 18% in urban cities. And we've all discussed about how there's an increasing awareness among parents. I think it's not affected by business cycles. You can see the growth rates. So Ganesh just showed you phenomenal growth rates in the last 4 years. I mean, we're talking about a recessionary environment here, and yet people are talking about 100%, 80%, 40% growth year on year. For-profit is permitted. We've talked about that. There's low investment required. It does not require a lot of investment in infrastructure. Anybody can start a preschool or even franchising as well. There are a lot of extra revenue sources built around the preschool as well. There are profits from books, uniform, daycare, summer camps, winter camps, and you can build on the whole ecosystem around the preschool. So, like, for example, some brands have gone into K-12, like we have done. Z has gone into their own channel as well for children. So there's a whole ecosystem that you can start building around the preschool model.
Along with education and governance, healthcare for emerging India was another hot topic under discussion during the 2-day eINDIA 2013. Government initiatives for better healthcare and building effective PPP models were just two of the many topics discussed.
We can create a very high-speed fiber backbone exchange of collaboration where the technology, the skill of the surgery or the interventional procedures can be transmitted to the mentees, and it can be mentored by eminent teachers located far off places. And we can develop an interactive platform of digital learning, giving an environment as if I am present in the site of the education. So this kind of environment we can visualize, this will be a virtual national medical university. So with that kind of feeling, so that what we expect, that we'll have a virtual classroom in each and every medical institution, and where there will be facility for video conferencing and real time, and multiple institutions are present in the same time, and it can be also in one-way mode by webcasting or streaming, or there can be a repository at central and regional level which is accessible to each and every learners involved in the healthcare business. We have now models of PPP, the need of scaling of those things, and we have to promote mHealth. Today, as you saw, the power of mobile technologies is so much, we can address many of the chronic disease management. You know, this year the WHO has announced hypertension is the disease of the year. Can you imagine hypertension, which all of us know about it, and many of us suffering it, and we know this can be addressed by just a mobile phone. So that is possible for chronic disease management. We have to think about that. And lastly, you know, the 2015 the deadline of UN to achieve the Millennium Development Goal in the health. There are 3 points in the health to be addressed, and you know, technology is the only thing which will only achieve, will be able to achieve MDG in health, provided we adopt it.
One of the most important health reforms which have been observed in the last 10 years globally and especially in developing countries is increase in the public spending. Second is the devolution of management. That is increased autonomy to the state and local government bodies in managing the health programs. Disease incidence profiles have changed over the last 10-15 years. We have increase in non-communicable diseases and lifestyle diseases like heart disease, diabetes and cancer. We have increasing publicly sponsored health coverage like Rajiv Gandhi Swasthya Bima Yojana. Innovations are the core driver of growth in the health sector in India today, which require a lot of investment. Like mHealth, we had discussed in this very conference, telemedicine, use of Ayush, that is Ayurvedic, Yoga, Siddha and homeopathy. Micro-insurance and medical tourism are also increasing.
The scheme that has been introduced in the government of Andhra Pradesh, by the government of Andhra Pradesh, this Rajiv Aragyashree Health Care Scheme, in fact it has become a novel scheme and a model scheme for the whole country because of the importance and the success of the scheme. Many states have started emulating the scheme. So the expenses that the poor patients used to incur during the for the hospitalization, if you look into the statistics, it used to be the almost the borrowings is 63% is the borrowings, and the selling of assets is 12%. If you look into the rural areas, in fact the poor patients already they are suffering with various categories of the problems, especially the farmers, so are already selling their assets for the farm loans and all those things. But unfortunately, because of that, they are already spending a lot of money on the health related issues itself. So keeping that in mind, this scheme has been initiated with the intention of to bring these patients under some coverage so that the patients can be treated without investing any money from their pocket. That is the main idea of the scheme to start with. And the goal of this scheme is basically to provide the cashless quality medical care to all the BPL families in the state of Andhra Pradesh.
Coming up after the break, the eINDIA 2013 Awards.
We're going to give this umbrella to each of the teams. Trade this umbrella. You have 2 hours with you. But when you come back, I want to see a bag full of items. Trade, barter, get me the best.
हमसे छात्र ले लो, अब हमें कुछ किताब दे दो.
Just dive into that bag. You will find something.
₹200 का ये बोतल ₹12 की है.
The number of trades were less, the value of the trades were less, the quality of the trades were questionable.
I don't agree with these judges in the fact that what we're doing when your partner was there.
The important thing is they worked under pressure. They were tasked to do it, and you were fiercely competitive.
Presented by Reliance Commercial Finance, tailor-made loans. Powered by Hyundai, Live Brilliant. In association with Acer, perfecting the power of touch. Mentor and investor, Seed Fund. Online partner, btvin.com. Concept partner, Big Daddy Productions, a global sport company.
गाड़ी तो अच्छी है, पर एक सेकंड ओपिनियन लेते तो.
See that? First opinion, second opinion. Over 6 lakh owners.
हम मशीन्स नहीं बनाते, जानते हैं पल्स आपकी. A better life, a better world. खुशियां बढ़ाते हैं, जोड़ते हैं फ्रेंडशिप, बनाते हैं कुछ अनबिलीवेबल, चुराते हैं वो खूबसूरत पल, दूरियां मिटाते हैं. हम मशीन्स नहीं बनाते, बनाते हैं
A better life, a better world.
Panasonic.
Complete life. Chevrolet. Find new roads.
Every CEO needs to know his market. It's about growth. It's about strategy. It's being on top of your game. It's really about getting started. Sometimes you need to throw people out of business to stay in business. What a CEO knows, what a CEO needs to know. Let's talk business. Watch in business.
It's the hunt for the right three-piece suit and accessories to go with it.
We're also carrying a review of the Galaxy Note 3.
We're raising a toast to the culture of drinking sparkling wine. And we also catch up with the MD of Moet Hennessy.
If you're used to Ritz-Carltons anywhere else in the world, how close does this one, the first in India, come to that experience? Here's showing.
eINDIA 2030, the two-day conference and expo on governance, education and healthcare from an ICT perspective was capped off with the eINDIA Awards 2030 that honored and acknowledged the initiatives in governance, health and education sectors from across the country.
eINDIA is not possible without e-states, e-districts, e-divisions, e-mandals or taluks, e-villages. Still, 70% of our population, near 70%, they live in villages. In urban areas, we have got about 24% living in low-income settlements. If e-governance is going to have a real success, then we need to improve our services to the citizens, those who are at the bottom of the pyramid, those who are marginalized, left out of the mainstream development process.
This is about health insurance, and the project is Chief Minister's Comprehensive Health Insurance Scheme. This is to the government of Tamil Nadu.
The innovative initiative in healthcare, the Jury Choice Award in this category goes to none other than Dr. Lal Path Labs Private Limited for the project Laboratory Information Management System Transformation. Award for use of technology in teaching learning goes to KIIT International School, Bhubaneswar for the project KIIT Kriya Learning Studio. The Public Choice Award for Government Initiative in Education goes to UP Electronics Corporation Limited for supply of 15 lakh laptops across Uttar Pradesh. Award under the CSC initiative, and this goes to Northern Power Distribution Company of Andhra Pradesh Limited for the project project consumer services through CSC's Me Seva. A big hand for Me Seva. We move on to the Jury Choice Award for E-Governance Initiative, and it goes to Directorate of Information Technology, Government of Maharashtra, for the project MahaGov Cloud. The Public Choice Award, ladies and gentlemen, please put your hands together for the Public Choice Award of G2C initiative that goes to the Department of Information Technology and Communication, Government of Rajasthan, for the project eMitra. The Jury Choice Award for G2C initiative goes to the Ministry of External Affairs, Government of India, for the project Passport Seva project.